Assalamu alaikum everybody. Today we are going to discuss the anxiety disorder in very simple way. My name is Dr. Mohamed ElWasify, Assistant Professor of Psychiatry. Inshallah, today we are going to discuss the following items. What are the concept of normal anxiety versus pathological? What are the classification of anxiety disorder, the general etiology of anxiety disorder, the main features, and general lines of treatment? Let's go on our journey today. So, first, how can we differentiate fear from the anxiety? Both are normal physiological and psychological response. The fear when you have like a body response to serious threat, experience it in face of real immediate danger. So you have actually a certain threat that your body react to this in a certain way. The anxiety is a body response to vague sense of being in danger. So actually, you can have the sense of anxiety without having a source of danger that is exposed to you. So the this is so anxiety like and fear are normal. Do they have any importance? Yes, they serve important roles as adaptation, initiation, motivation. The anxiety will prepare us to take action, but however, this should be in moderate amount. So, although unpleasant experience of fear and anxiety often are useful, however, some discomfort is too severe when these reactions are much in severity, frequent, the duration is too long, and triggered so easily, so you are going to have the anxiety disorders. So it's normal versus physiological. You just need to know one column. So it's normal anxiety less severe, short in duration, have adaptive response, no suffering, no impairment in functioning. It's improve your performance. The clinical features of anxiety we have. This is present in all of the anxiety disorder. You can have some of these or all of them or according to the disorder. So it can be somatic and can be presented in the form of tachycardia, palpitation, chest pain, constriction, pain in the belly, pain in all of your body. You can have like sweating, nausea, vomiting, dizziness. So, and this is one of very important because a lot of us when having some of these somatic complaints, they didn't recognize, they don't know that this is like aspect of the anxiety. They go to medical doctors, you go to cardiologists, you go to neurologists, sometimes you go to traditional healers, you go to the sheikh after doing a lot of investigation without any response. Also, they can have a psychological part like worry, fear, irritability, restlessness. Restlessness means that the person can sit. He just like awake, going, move. Hypersensitivity, easily loss of temper, and impatience. So, in the form of cognitive aspect, the patient has decreased concentration, decreased ability to learn, difficulty in the memory, difficult to organize the task, difficult in attention. So the etiology of anxiety disorder, they have a common like general aspect of this, like a biopsychosocial aspect. So they have biological, like genetic factor, decreased GABA, causing CNS hyperactivity. Psychological, they have a lot of series explaining this. So also the family background, have a history of abuse. This can having a role in causing anxiety. Anxiety disorder are the most common psychiatric disorder. So it's the most common mental disorder in USA. Most with primary anxiety disorder also suffer from the secondary. So we have a lot of combination between one anxiety disorder and the others. This they can like two or more anxiety disorder, one caused by the other in 55%. There can be two or more independent anxiety percent, 26. One anxiety disorder is 90%, 19%. So the anxiety disorder and OCD, this is our our topic today we have in the DSM-5, it's called Diagnostic Statistical Manual 5. This is like the American System for Classification of Psychiatric Disorder. So we have the Generalized Anxiety Disorder, Phobia, Agave Phobia, Social Anxiety Disorder, Panic Disorder, and we have a separate one is Obsessive Compulsive Related Disorder. So generalized anxiety disorder, it is mean that you have like for about 6 months you have a sense of apprehension, dread, like sense of like impending danger. This anxiety is free floating under all of the most circumstances, and you worry about particularly anything. So sometimes the patient can describe, doctor, I feel sometimes that I am relaxing, I am like in a new place, I am in a vacation, but I don't know. I all the time feeling that I am going to have a danger, I'm going to have a problem, I have a catastrophic thinking, catastrophic expectation. So the most of symptoms of the anxiety, like feeling of restlessness, keyed up or on the edge, fatigued, difficulty concentration, muscle tension, all of these can present for 6 months at least. It's like example of what the people write about their worrying. So the phobias are different from fear. So the fear you have like a response like to an immediate danger or threat. So the phobia here you have persistent, unreasonable, irrational, irresistible fears of particular object, activities or situation. So the people with phobia often like they having avoidance for this object, and also having what we call anticipatory anxiety. They all the time expecting to have these symptoms of anxiety, even sometimes this coming anticipatory anxiety just by thinking, not even by exposure. So we have different types. We have the specific phobia from a specific object or situation. We have 5 categories, like can be animal, natural environment. It can be like from blood or injection, can be situational, can be others. So also the specific phobias, as we said, in order to differentiate phobia from fear, the like we have to know that the phobias are irrational, irresistible, severe, persistent. You have like you try to do avoidance of this. It impairs your functioning, your social functioning, your academic study. So they actually are disorder. Phobia, afraid of being in situation where escape might be difficult should they experience panic or become incapacitated. Agoraphobia, it is like avoiding crowded places, driving, and public transportation. Many experience panic attacks and may receive a second diagnosis of panic disorder. So this patient, when being in a place where they can't be escaped, they having they can experience a panic attack. A panic attack is sense of impending death. You feel that you are going to die, you are going to be crazy, you are going to lose your mind. You have a very sense of chest constriction, tightness. So we have the social anxiety disorder. This is mean that we have the persistent, irrational, irresistible, severe anxiety about being in situation where you judge yourself as being defective and that the people are going to embarrass you. So the people judge themselves as performing less. So the the panic disorder are characterized by having frequent panic attacks for at least 1 month. These panic attacks are, this is like coming sudden, unexpected, periodic. They having they having a peak. They usually last from about maybe from less than 2 minutes, 3 minutes, 5 minutes, up to maximum like to 20 minutes or 30 minutes. So during these panic attacks, the patient have the sense of the fear that they will die. They go crazy, get loss of control. They usually have like the same as of being having a heart attack. so angina. So usually they go to the emergency department. Usually they do a lot of investigation, even cardiac castrations. Sometimes these people are misdiagnosed with a lot of medical disorders. Usually they can have like oxygen, or inhaler, and this is without any benefits. So these attacks happen in absence of a real threat, and all the time the person is occupied. What about if the attack coming? So usually these patients avoid to do their activities, and that is why if we have a question, what is the most common psychiatric disorder associated with the panic disorder, it's actually the depression. You try to avoid everything in your life. Panic attacks repeatedly, unexpectedly, and without apparent reason experience dysfunctional changes in thinking and behavior as a result of the attack. So the panic disorder are a separate disorder, or we can having like a panic disorder comorbid with agoraphobia. We have the last one, the obsessive compulsive disorder. This is like very common, and usually this disorder, the people think that the ideas that comes to their mind, or the images of the thoughts, and because they can't resist these ideas, they think this is from devil, or this is they having like outside force controlling them. They usually going for traditional healers, for sheikh, for like a lot of these peoples, but usually this is like just a form of an anxiety that coming in the form of thoughts or ideas or impulse, or sometimes image that invade patient consciousness. So usually they wanted to decrease this anxiety, so they do repetitive rigid behaviors or mental acts that the people feel they must perform to prevent or reduce the anxiety. Obsessive compulsive disorder, usually in order to diagnose the symptom, should they feel excessive or unreasonable, causing reading distress, take up much of time, interfere with daily activities. So when you have obsession, they causing you an anxiety, you try to reduce them, you do some actions, then you feel you are relieved, then you get the same ideas again, like the obsession of contamination, or that I am not clean. Okay, I will go to the restroom, I clean myself, I take a shower, this is reducing the anxiety, then I having the ideas again. So the problem is not on the shower, or the problem is not that you are not clean, it's just the problem is like in your mind you having a defect in the neurotransmitters like serotonin. So it's equally common happen in male and female. So the obsession having a common themes means common topics. So all the people that having obsessive compulsive disorder, most of them they having this obsession comes in dirtiness, contamination, in violence, in aggression, in religion, in God, in orderness, in sexuality. So this compulsion, this is as we mentioned before, the people doing these actions in order to reduce their anxiety. They have a common form like cleaning, checking, ordering, touching, verbal and or counting. We having like a spectrum of obsessive compulsive. It's called obsessive compulsive related disorder. So this disorder having also the same ideas of like the patient is obsessed by certain pattern of behaviors like hoarding books, for example, hair pulling, or what we call trichotillomania. Some people having impulse to pull their hair. This can happens in the forehead, on the eyebrow, on the eyelashes, and usually they go for dermatologist. And the problem is not that the doctor put you cream or or do laser or something like this. The problem is in your mind. You need to adjust these neurotransmitters. Shopping, it's the same. Sex addiction or shopping addiction. We also having like in the DSM 5, they categorize it in hoarding disorder, hair pulling disorder, skin picking disorder, body dysmorphic. What's mean by body dysmorphic? You perceive yourself or you perceive your body as being defective. You perceive your body as being defective. So you see yourself that you are defective. How we can treat? So the mastering or the best evidence method of treatment is to combine a form of pharmacotherapy in the form of like you can give antidepressant in the form of selective serotonin uptake inhibitor or antidepressant or serotonin norepinephrine uptake inhibitors. This is like we can combine one of the pharmacotherapy of this plus cognitive behavioral therapy. It is a form of psychotherapy that dealing with like how the thinking affecting your behavior, affecting your emotion. So let's go over the pharmacotherapy. So usually we start the patient with like SSRI or tricyclic antidepressants. The term antidepressant is a misnomer because this group of category of drugs like what we call antidepressant is not working just on depression. They are working in depression, they're working in OCD, they're working in panic, they're working in generalized anxiety, they're working in eating disorder, they're working in schizophrenia. So this is a misnomer. So please don't panic and say when you go to a doctor and they prescribe you some medication, don't say that I don't have this, I don't have this, why is the doctor giving me this? So the medications having a lot of uses. So we have to give the patient like antidepressant like SNRI or tricyclic antidepressant, and we combine usually benzodiazepine in order to absorb the severe anxiety that present in the form of tachycardia or palpitation or something like this, but we have to give for a short time. We have also other drugs that can working for these anxiety symptoms the propanolol. Usually they use for tremors, for tachycardia, for palpitation, for the sense of panic attacks. And buspirone is usually 5-HT2/1 a partial agonist, and it is non-benzodiazepine, and usually they we used it commonly in order to decrease the anxiety in the form of generalized anxiety disorder, and usually also we can use buspirone to antagonize some of the side effect of antidepressant. For the psychotherapy, as we mentioned, the cognitive behavioral therapy is the master, is the best type of psychotherapy for treating anxiety disorder. We can having like the psychodynamic psychotherapy. This is usually we have to know what is the cause for development of this anxiety. Inshallah, if you having any questions, any comment, you can contact me as you have my contact information in the first slide, and I'm happy to answer any inquiries or any questions from you. Thank you for your time. See you.